roundup out on JCO, cabozantinib, and nivolumab alone, or with ipilimumab for advanced metastatic urothelial carcinoma and other GU tumors. See, both combos have manageable toxicities with durable responses and encouraging survival. Out in New England, Javelin 100 frontline maintenance avelumab shows largest magnitude of OS benefit in the history of bladder cancer medicine. 200 sites, 700 patients, amazing results. ESMO Resilience Task Force, in collaboration with the OncoAlert Network, finds oncologists' stress and burnout has increased during the COVID-19 pandemic. Research results to be presented at ESMO 20. Out on Annals, sacituzumab govitecan shows encouraging activity in patients with pretreated hormone receptor positive, HER2-negative metastatic breast cancer and a predictable, manageable safety profile. In 54 patients receiving sacituzumab govitecan and at least 2 prior lines, the ORR was 31.5%. Out on Clinical Cancer Research, the Patricia trial, palbociclib in combo with trastuzumab is safe and exhibits promising survival outcomes in trastuzumab pretreated ER-positive, HER2-positive advanced breast cancer. Out on European Urology, final OS comparison of TIVOZANIB to SORAFENIB as third or fourth line for metastatic renal cell carcinoma shows no difference in overall survival between the treatments. FDA grants pre-market approval to oncoming DX target test as a comparison diagnosis to ID red fusion positive metastatic non-small cell lung cancer candidates for pralsetinib. Out on Cancer, a pooled analysis of 3 randomized control trials sees pembro plus chemo demonstrates response and survival improvements with manageable safety in comparison with chemo alone in PD-L1 negative advanced or metastatic non-small cell lung cancer. Lancet Oncology ctDNA testing offers accurate, rapid genotyping that enables the selection of mutation-directed therapies for patients with breast cancer, with sufficient clinical validity for adoption into routine clinical practice. The ASCO Advocacy Summit sees that less than 5% of patients with cancer participate in clinical trials. We need to improve this, and we need to improve cost barriers. Clinical trials are promising options. Medicaid, which disproportionately covers minority populations, is the only major payer that does not cover routine trial costs. Your OncoAlert network is here to cover ESMO 20, inviting colleagues to follow us and use the OncoAlert hashtag. Do not miss the OncoAlert podcast this week featuring Dr. Paul, Dr. Shabaya, and Dr. Patel.